2020 COLAs. What this is some additional state funding that has been awarded to our providers by both OMH and OASIS. This was part of some wage adjustments that were in the budget. And so we want to be able to pass this funding through to our providers. And you can see that the totals, what they total up there for each agency and which agency the funding is coming from. Harry, do you have any other comment on this table?
No.
So the total is approximately 61,000 and almost 62,000 in Warren County and 13,800 in Washington.
Rob, do you need the counties to vote on accepting the COLAs in, or, okay.
Yes, we'll need a vote from each county to accept.
Okay, so from Warren County, does anybody have any questions about the COLAs as they're presented? Any concerns or issues? Okay, so for Warren County, do I have a motion to accept? What's that?
I'll make a motion.
Oh, I'm sorry, there was a comment, I didn't see a hand.
Sorry, it's Rob. Just one comment is that what we need to vote on is a motion to accept the funding and amend the contracts in accordance with this, the table.
Contracts and amend table. Okay, thank you for the clarification. Okay, so for Warren County, do I have anyone willing to make a motion to
I'll make a motion.
accept and amend? Cindy, do I have a second?
I'll second.
Thank you, Maureen. Did you catch that, Rob? Cindy and Maureen?
And Maureen got it.
Okay. All in favor in Warren County of accepting and amending, accepting the COLA changes and then amending the contracts appropriately? All in favor?
Aye.
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 Any opposed? That might be easier to do in this format, huh? Just who's opposed? Okay. Any abstentions? Excellent. Motion carried in Warren County. Heather, to you.
Okay, for Washington County, can I have a motion to accept the COLA and to amend?
I'll make the motion, Tammy.
There a motion, Tammy? Is there a second?
I'll second. Desiree.
Desiree? Okay, any discussion? No. Any further discussion? Okay, no, sorry. I'm trying to read off my paper and at the same time. All in favor, say aye.
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 Any opposed? Okay, motion carried.
Thank you.
Okay, the next items that we have on the agenda are informational items. And I don't know about you guys, but I'm dying to hear some things from Rob and some updates related to everything that's going on. So Rob, I'm going to pass it over to you.
Okay, so, I had sent out an email giving a little bit of information and updates on the impact of COVID-19, locally to our service system, our residents, to our office. But just to kind of recap, I guess, and to provide some additional information.
On the agenda.
Was there a comment? Okay, sorry, I thought someone was trying to comment. So the staff of the office have been working remotely since March 17th. We've all been working from home primarily. Occasionally, we'll come into the office if there's some function that we need to do here necessarily. But then we, usually do what we need to do here and then go back home. We are in touch with each other each day throughout the day through email and telephone calls. We continue all of our work with our providers, via teleconference or video conference meetings. Crystal does stop into the office a couple of times a week to process mail and to check the fax machine. When staff are here, they also are doing the same thing, checking mail, checking the fax. We have an ability on our copier machine that we can scan to email. So if there are faxes here that need someone's attention, then those get scanned to the staff member. The same with any important mail. Let's see, one of the first tasks that we had, I think, when we were working remotely was to make sure we had some information up on the county's COVID-19 websites. Both Warren and Washington County have dedicated pages on the county website with information for the public. So we put together some resources, wanted to be sure that those resources were prominent on the county pages and available to the public that would be maybe looking for them. We also did some targeted outreach of some information on dealing with the stress of the pandemic to all the county employees and also to particularly the public health staff of both counties. We wanted to make sure that they had access to these resources that, dealing with just the stress of the pandemic and maybe change in work conditions, including some self-care strategies and some information about support lines and things like that. If anybody hasn't seen the information on the websites, it really should be easy to find. You go on the county websites and you just click on the COVID pages, and then from there, it's usually under helpful resources or something like that. We were also asked in Warren County to develop a service, some resources that would be almost like a virtual family assistance center. If we were to have some other types of mass fatality in our area, the county would set up a family assistance center, and we would be part of that with our disaster mental health team or with our providers, providing assistance and support in that manner. However, obviously with an infectious disease, you can't set up an actual center where people could come. So we set up something virtual on the web pages. So the key service, or the primary initial service, is provided by Parsons Child and Family Center. Their mobile team offered to be a first point of contact, where people can, families that are grieving, excuse me for that. So families that are grieving, or maybe they have a loved one that's in a serious stage of illness, can contact the regular mobile crisis number and get a clinician on the other end that provides some initial emotional support. They have the ability to do a follow-up connection with them as well, telephonically. And then they've been given some resources to then assess and refer further as needed. So we're very appreciative of Parsons offering that, because that's really a key service, rather than just directing people to a website or hoping that they find it. This is a number that gets into the hands of these families. We did targeted outreach through Glens Falls Hospital, the ICU staff, their chaplain or pastoral care staff have this, and also we did targeted outreach to the nursing homes because so many numbers were coming from the nursing homes. So families are given this information, and then they can choose or not choose to either make a call to connect with someone or to go on the website. There are some specific grief related resources on the Family Assistance Center portion of the website. High Peaks Hospice is also a partner with us on this, and one of the resources that the families are then also referred to for further follow-up.
Rob, I'm sorry, did you say, is that for both Warren and Washington County, those services?
Those services are for both Warren and Washington counties. The outreach included Washington County nursing homes. The information, it really resides mostly on the Warren County website. It was shared with Washington County, but we've just, my understanding is that it has not been put up on the Washington County site.
Okay.
But people are still directed to the resources on the Warren County site.
Okay, thank you.
And the services themselves are available to residents of either county. Okay. We continue active work with our providers also in terms of impact to the local provider system. In fact, that was Deb Rowell just now calling me. I had asked her for some updates from CWI. So I will catch up with her later. So I think you were pretty much aware of the initial impact to the service system. Any day programs like Liberty House or Eastside Center had to close. The Peer Respite had to close. The clinic operations, outpatient clinic services continued remotely. Clinicians were working from home, and some of the telehealth regulations were relaxed. Clinicians were allowed to connect with their clientele either by telephone, or they also were starting to use some of the telemental health platforms like DoxyMe and some of those. So they have been able to maintain their connections to the clientele, although they do tell me that there were some folks who just choose not to do it. And service available to them, but they chose to just maybe wait a while and connect when they can come again in person. In terms of our care management programs, the health home care management, there's still both in-person and telephonic outreach going on. Mobile crisis has continued both in-person and telephonic. To the degree they can, they try to do telephonic, but for folks that either are not able to or they feel there is a need to connect in person, then they're able to do so. Obviously, the clinics also have to maintain, if someone needs to have their medication administered, like an injection. So those are still in service, in-person services. For the day programs I mentioned that closed, like Eastside Center and Liberty House, their staff also went to work remotely, and they've been connecting with people telephonically, making sure they have access to, food and medications and those kinds of social determinant needs as well. I mentioned the Peer Run Respite had to close, but they maintained their Peer Warm Line. They have a Peer Warm Line, and that's been a good sense of a good source of support to the mental health community throughout the pandemic as well. Several weeks ago, you are probably aware, the Glens Falls Hospital had to furlough some staff, and approximately 50% of their outpatient clinic staff were impacted by the furlough. The restriction on performing elective surgeries severely impacted the hospital, and their revenues were down over 50% at that time. And so it was really a severe fiscal crisis for the hospital. They initially were not eligible for some strange reasons for some of the initial federal aid that was made available to hospitals. You know, either they weren't rural enough or they weren't in enough of a hot spot. For whatever reasons there, they didn't qualify for the aid, and so they didn't get it. Now, recently, you may have heard there was a more recent issuance of some federal aid that's basically like a advance on some of their funding. So I think it was around $20 million. I'm sorry, I don't have the exact number. So that is a big relief to the hospital.
Rob, can you hear me?
Yes, I can.
It's Marlena.
Hey,
So
Marlena.
I'm here. Yeah, so we were able to tap into the federal government and get about $20 million. It's technically a loan.
Yep.
And so that really saved us from really, lack of a better word, going under. And then, like you said, working for certain criteria. So in terms of how many COVID patients we had, we weren't rural enough. We were too rural. You know, there was all kinds of stipulations, but we pushed through it. And the governor has lifted some restrictions. So elective surgeries have, we're allowed to do them now. Our census has gone way up in the hospital. And so we're getting back to, I guess, a new normal.
Very good, Marlena. Thank you for that input. I didn't know you were on, and thank you.
Yeah, it's definitely was scary. Continues to be a little bit scary, but we'll get through it.
Okay. Just in terms of the recall of staff, can you just give a little bit of an update on that, Marlena?
Yeah, sure. So, you know, the positive side of all this, in April, we had to furlough, like you were saying, approximately 50% of the workforce in behavioral health. And since that time, I want to say thank you to Rob for helping us work with the county and the state to ensure that the grants were advanced. And so we were able to bring some key positions back that fell under those grant positions. And that started probably the end of April. And then since that time, in the adult outpatient and kid programs, we were able to bring back the nurse practitioners and one clinician in each counseling center. As of this week, we were able to bring back the jail forensic counselor that's assigned there. And next week, we're going to bring back 2 KSACs, one for each recovery center. And the following week, the director at one of the recovery centers will be returning. So each week, you know, we're looking at volume and see how we can have staff return to the programs.
Very good.
We're also doing telehealth, like you were talking. Very successful, to be honest. We're doing a lot of, it's interesting what population likes to do what. The adult program is definitely more comfortable with telephone. So we've been doing a lot of telephonic sessions and probably have anywhere between 80 to 90% compliant rate. So people are liking that platform. In the child and adolescent programs, we were able to get the DoxyMe up and running, and that's been very instrumental in doing sessions with the families and children. And then we're doing a lot of telephonic sessions as well at the recovery centers.
All right, very good. Thank you, Marlena.
Mhm.
Any questions for Marlena on her update? Okay, just, yep.
Rob, I don't have a question, but just wanted, again, as Marlena, thank you for your help. And certainly working with Marlena and the folks at Glens Hospital was really a great success. And I'm only disappointed in myself that it took me about a day to get on the horse of reaching out and saying, what's going on? So it was a really nice, quick turnaround, very responsive, and we certainly appreciated it.
Thanks, Tammy. It was great working with you as well, and we appreciate everything you did.
Thank you.
And I was just informed that the YouTube feed is live now, so just so you're aware. A couple other updates that maybe Marlena mentioned and I missed it, but the inpatient behavioral health, the crisis unit, and the emergency room evaluation clinicians were not impacted by the furloughs.
Right.
The recovery peer services in the community have remained active. Again, they can't have their in-person gatherings or meetings, support meetings. But they are utilizing a video conference to connect and support each other quite a bit, actually. We were hearing about some increases in overdoses in other counties, particularly like around the Capital District and some other places within the state. But we weren't seeing that locally. Knock on wood, I hope that's still the case. One of the things the Hope and Healing Recovery Center has been doing is trying to help keep a supply of Narcan available in the community. They're doing deliveries, curbside pickup, that sort of thing, to make sure that the Narcan is still getting out into the community. As you know, Narcan can reverse the effects of an overdose. And some of the thinking is maybe the increases were related to there being less Narcan available. So I appreciate their efforts in that regard.
Rob?
Yeah.
It's Linda. Also, one of the causes of the increase in overdoses is there's a high volume of fentanyl being added to the heroin. They do now have available, I didn't mean to make you go away. And they do have fentanyl strips that they can apply. The same phone number that they would call for a Narcan kit. Hi, thanks for coming back. The same phone number that they would call for a Narcan life-saving kit, they can also get the fentanyl strips to, God, if an addict would go that far, to test their drug before they use it to see if it has the fentanyl. That has been advertised yesterday and the day, I think today's Thursday. Tuesday was the first day I saw it advertised. Anybody who needs more information, I will get the phone number and I'll be more than happy to share with Tammy and just give me a contact person at Warren County.
Linda, if you could, whatever information you do have, if you could send that to me and Crystal
Sure.
by email, that way we can, look at it and then distribute, as appropriate.
Sure, absolutely.
Also, our residential mobile crisis, the ACT team, health home care management, those have all continued operation. They did have a little bit of a scare in one of the residences. They had to quarantine. Someone had become symptomatic and they had to quarantine for some period while they awaited the results of a test, but it came back negative. So that was a relief. But it was a challenge for AMH because they had to quarantine and then obviously staff had to participate in that quarantine as well. Just to go on in and talk a little bit about the transition of the behavioral health outpatient clinic services from Glens Falls Hospital to Citizen Advocates. That also has been impacted, unfortunately, by COVID. They had run into some delays before COVID hit related to their electronic medical record. And then COVID, and so Citizen Advocates really ended up just having to put the project on a hiatus status, and it's still at that point. Unfortunately, we're really in a holding pattern at this point. They also, we've been in close contact with them, and we've recently learned they've had some turnover in their executive leadership and also some of their board. So we're monitoring those things closely, and we're, working with them and the hospital. Any questions on that? I would say that the hospital has indicated that, again, that even though the delays have occurred, that they are committed to continuing operation of the outpatient clinic services, both mental health and substance abuse addiction services, until a transition can occur to a new provider. Marlena, do you have any other update related to that? Anything else you would want to add, or?
No, thank you. It's been placed on pause, like you said. I know that leadership started talking again, so I think that's positive. But the whole COVID thing, I think, really put a kink into the system. I know in terms of the electronic medical record, they weren't able to find people to, go to work or to deploy to start that whole process for electronic medical record. So I'm hopeful now that the government is lifting and we're moving through our phases and we can resume conversations.
Okay, I can't recall, because we had to cancel some meetings here, whether or not I had provided the update or not, but Parsons and Northern Rivers had also applied to open an outpatient clinic in the community. It was going to be just a standalone clinic, not part of a transition of the hospital services, just something separate. But their application was actually denied by the Office of Mental Health due to fiscal viability issues. And what they have stated is that they would be willing to re-examine the issue after a transition of the hospital services does occur. Once they kind of let that transition occur and then see what the level of need is in the community, then they might be coming back to propose maybe a smaller satellite operation that would be more fiscally viable. And then the other sort of impact, I guess, COVID-related update would just be the reopening planning. Most of our agencies are actively working on reopening plans. Precautions and safeguards, how they can safely resume any in-person services. Most of these services will probably be phased in somehow. What we're looking at in terms of our office is maybe staggering schedules for a while, having reduced staff presence on site. The Association for Mental Health has a pretty extensive, well thought out plan for building access here at 230 Maple and in their other, buildings and operations as well. But Andrea Deep has been working closely with us since we are tenants here, sharing her plans with us. And I can say it's really made my reopening planning a lot easier, because I can follow her lead, and that way we're doing the same thing that everyone else in the building is doing, not operating in some different fashion. So, basic things like the social distancing, the wearing of masks, the screening upon entry to the building, limiting appointments in the building so that we limit the number of clients and public in the building at a time. There are limits in the conference rooms on the numbers and the distance of the seating. Seating in the waiting room has been reduced to respect the 6-foot distancing. We're looking at cleaning regimens and disinfecting regimens for our offices and shared spaces. All of this sort of thing is the kind of planning that we're doing. The Warren County has scheduled a department head meeting for tomorrow, I believe, just to talk with the department heads about any more specifics about reopening. Any questions on that? I anticipate probably sometime in June, we would be starting to, starting the reopening and having staff on site more often. Okay, does anyone else have anything, comments, questions related to COVID-19 before I go on to any other updates? I think we already covered the outpatient services transition update as part of those updates, so no need to say anything more there. I did have an item on the agenda for Glens Falls Hospital advocacy, and that was actually an item that I put on the agenda before they were able to secure the approximate 20 million in federal assistance. So I guess I would move on then to the 2021 New York State enacted budget update. And you should have a handout in your packet on this. It's a memo that our statewide association does for us every year. They do one when the governor comes out with his proposed budget, and then they issue an analysis once there is an enacted budget in place. A couple of items that were of concern, that are of concern to us, that made it into the budget, that although we had advocated strongly against this, we have both. One item that was in here relates to 100%, you'll see it at the top of page 2. It's 100% cost shift to counties of the 7/30/20 CPL competency restoration costs. These are, this is traditionally had been a 50-50 split, with the state paying 50% and the county paying 50%. These costs are related to felony level offenders who are found to be not competent to stand trial. When that occurs, they are sent to an state inpatient facility for the restoration process. And the charge for that restoration process and treatment is approximately $1,000 a day. So previously it was about a $500 charge to the county and a $500 charge to the state. So the state has reversed this to be a 100% county charge. So that's concerning to us. I did some quick numbers just to look at the past 4 years, what our chargebacks from the state have been for these competency restoration costs. And on average, for Warren County, the costs have been about $34,000 a year total county expense. So that will, approximately that would double. So that's about the impact that the county will see as an increase. And again, it varies widely from year to year, so it's very hard to predict these expenses. In 2018, our expenses were over 92,000 in 1 year. And the prior year, in 2017, in Warren County, it was 0. So we see wide variation. It's hard to budget for, but on an average, it would probably be, somewhere based on these 4 years, looking at it, would be an impact of about $35,000 a year to Warren County. Washington County, over the 4-year period, look back, had an average cost of $82,400 and something. So again, if you double that, you're seeing that would be the impact. It would be an increase of about 82,000 based on these past 4 years average. So that's very concerning. It's just a pure cost shift to the counties.
Rob, can I ask a question to Jim?
Yes.
It was the original, beyond the obvious of the cost shift itself, was the original logic related to the fact that people could spend some of their time in a county jail versus a state jail, so that they decided to do it that way because that's how it would work out? Or is it just always just been a cost shift? I'm trying to think of like how the cost shift started to begin with and why and what the logic was. And then now I'm trying to think about what's the logic of completely cost shift beyond the obvious, of course, how they'd be able to justify the complete cost shift, and why does that become a county expense?
Yeah, I mean, those are good questions. I'm not sure that I really have a good definitive answer for you. I think that it did evolve over time, and then that you know, at one time it was actually I believe it was a county expense because the counties operated the jails and were responsible for the inmates and their expenses. At some point, the state, I think this is how it went, agreed to pay the 50%, but now they've returned to being 100% county. What concerns me is that when it was a 50-50% split, the state had some incentive to expedite to the degree they could the restoration process, so that they could try to accomplish the treatment and restoration in as short a period as possible. Now, what incentive do they have to, to return the person in as quickly as they can? Some of the things that my statewide association is working on in response to this is we're developing some plans locally to meet with the criminal justice system participants, judges, the district attorneys, public defenders, to try to work out some policies maybe locally where we could look at, are there defendants that are maybe being ordered for a 730 because people are aware there's mental illness, and maybe there's other opportunities to divert them from the criminal justice system versus just following through with the 730 examinations. So we're going to be starting some of those kinds of conversations. I'm not sure to the degree, I mean, it's a certain portion or slice of the population that actually is impacted by this. They have to be a felony level offender, and to be the ones that are deemed to be not competent to stand trial. So we will be working actively on some strategies to try to reduce the numbers of defendants that end up having to be hospitalized for restoration. Now, some other states have begun to look at and have actually implemented some either jail-based restoration or community-based restoration when appropriate. So those are some other things that we might be exploring to see if we can try to reduce these numbers.
Rob, this is Tammy. So this isn't for the exam. They've already been declared or determined to be incompetent?
Correct.
For that, and is there cost sharing for that as well, right?
The cost of the exams is a charge to the county. So that's 100% county, always, as far as I know, always has been.
Okay. So they can still, so then there might also be some availability for some diversion of those, just the referrals that come from the courts on some of that. If you can educate people in the judicial system or whatever about other resources that are out there rather than going through this restoration than perhaps there is for the other two.
Exactly. That's what I meant to convey,
Yeah.
is that we would almost be part of the conferencing, you know, that goes on in cases prior to making decisions about ordering a 730.
Thank you.
Yep. Thank you. Okay, another issue that we are concerned about, also on page 2, right below that bullet, you'll see an indication there of a 10% reduction in OASIS and OMH administrative funding to the LGUs. So the LGUs are the local government units. That's the offices of community services, the county mental health administrations. So we did take a look at some of those numbers. Harry put together a table for us, and it looked like the impact, total impact, we anticipated to be somewhere maybe around 12,000, 13,000. We think some of this, or maybe most of it, may be offset by some federal salary sharing increases that we've seen over the past couple of years. Harry, anything more you would want to say on these cuts? Or
I
have
was
you
just sort of
heard-
waiting on the details of it. Exactly what price coded or program coded applies to.
Okay, so we'll keep you posted on that as we get more information. I know Harry's been trying to find out more information about it. Of course, you know, this came out even before really the devastating and economic effects of the COVID-19 were realized. And so now they're even talking about even much more drastic state aid cuts. So we've got our eyes on that too, quite concerned about what impacts that might have to our providers and to the provider system. Let's see, just couple other items, I guess, that are a little bit more on the positive side in terms of the budget are $60,000 in the jail-based substance abuse treatment and release transition services was continued. So both Warren and Washington counties are receiving $60,000 for either treatment and or some release transition services. So we're very pleased to see that that was not, impacted negatively. Also, the Veterans Peer-to-Peer Program, the Joseph P. Dwyer Program, continues to be funded at $92,500, and that's a joint program with Warren and Washington counties. And the funding comes through us, and we work closely with the veterans offices in each county, but they really oversee and administer that program for the most part. Any questions on any of these items from the budget? The memo itself, you'll see, has quite a few other types of, information about the budget in terms of each of the state agencies, a breakdown of each of the state agencies, and also a look at Department of Health and Medicaid funding. So you can read through the memo at your leisure. And if you have any other questions that come up about it, or you want clarification on anything, let me know and we can try to find out for you. Okay, so that's it on the budget. The local services planning cycle for 2020 is Carrie Wright on the call, our program analyst? I'm not hearing a response. So as you know, we are required to submit an local services plan every year to the 3 state agencies. We submit one plan now for all 3 agencies. That plan is usually due in June. The due date for that has been pushed back because of the pandemic. We are looking at the due date for that being later in the summer. So that gives us a little bit more time to try to organize some planning, which really is, more critical this year than usual, because we want to try to incorporate some of the impacts of COVID-19 and in our planning. Carrie is organizing some additional stakeholder meetings where she can gather some additional input from partners that maybe have not traditionally been involved in our planning. Some of the transportation people and just some other outside stakeholders like the United Way and other community stakeholders that may have an important input into our planning. When we get together again, if Carrie's with us on the next meeting, then she can provide more detail on her planning for that. So that is really all that I had. I don't have anything additional in terms of updates on the agenda. Is there anything else anyone wants to bring up, or any questions, concerns?
Hi, Rob. Chris here at DSS.
Oh, Chris. Hi.
How you doing?
I'm doing good. Thanks for joining us.
You're welcome. Thanks for including me. I just want to give an update in regards to what's going on here at DSS in terms of bringing workers back, because we're starting to phase that in. On June 1st, we're going to have almost 50% of our workers back here so that they can start catching up on some in-office work. I would like to mention that we have been able to meet all the needs of our consumers within the county during the crisis. But I am always having an open ear to anyone who might have heard of anyone who is slipping through the cracks. Please let them know that we are here, and that if they're not getting the services that they need and that they qualify for, that we will make sure that they get them. The other thing that is concerning is the heroin and cocaine laced fentanyl that's coming out. Unfortunately, this seems to be moving north, and what has happened, what I've learned from a couple other groups that I'm involved in, is that drug dealers are timing this in just about perfectly with the checks that are coming out from the government. So the drugs are hitting the streets right about the time that the checks are getting into their accounts, which is really insidious, of course. So unfortunately, a lot of people that struggle with these things are getting this money just as these new drugs are coming out on the streets, and a lot of the money that's coming from the government in terms of the stimulus is going to drug dealers, and unfortunately we are having some people who are not making it because of this. So we need to be vigilant and keep an eye out for that, because it is moving north, and I don't know if this is a fact or not, but there apparently might be another stimulus check coming out to people. So it's definitely an issue. And unfortunately, you do have people who take advantage of these situations, as we all know. And drug dealers and drug producers are definitely one of those groups. So we all got to be vigilant. Thanks. And thank you for your work. I know that you guys have been working remotely and have worked with a number of our clients as well through this difficult time. So thank you.
Thank you, Chris. Mary McLaughlin's on the call also, and I had spoken earlier today with Mary. Mary, do you have any updates from AHI or anything you wanted to share? You don't have to, but if you do.
No, actually, I think in the update, the COVID-19 update that you did, I think you covered pretty much everything. So I think we're good,
Okay.
unless people have questions.
Okay. Kim and Heather, are we at a point to adjourn the meeting? I'll remind folks that our next regularly scheduled meeting is June 11th at 3 o'clock. That would be the regular June meeting. We will send communication out to the board members to let you know if that meeting is on and how we will accomplish it. I'm assuming we will, if we hold the meeting, it would be also by Zoom. So this is a good trial run for us probably. We may want to continue meeting in this fashion for some period of time. Or at least having it as a part of an option as we limit the in-person participation on site.
Thank you, Rob, for all the information and getting us all that data and everything. It's really helpful to hear what's been going on behind the scenes. If there's nobody else that has anything else they wanted to ask or wanted to contribute, I do want to just make a point that with some of the patients that I work with, I've been hearing how wonderful the community resources have really been to support a lot of these folks. Like over at the Eastside Center, they've been calling them daily, giving them food. It's been really lovely to see the way the community's really pulled together to help so many of the folks in need right now. So that's been really nice to see. So props to everybody and everything that you guys are all doing. Rob?
I would just want to say too that I hope everyone is healthy and remains healthy, you and your families. Hope everybody's managing this pandemic okay.
Same to you.
Yeah, absolutely. So if nobody has anything else, I'll go ahead and call for the meeting to be adjourned. It was lovely to see you all. Stay safe and healthy, and we'll see you in June.
Bye, everyone.
That's good.
Bye-bye.
Bye.
Thank
Bye.
you. Bye-bye.